Organ transplants provide patients with a functional organ if they need one, like kidney or heart at times as well. The most common type is an allograft, meaning from the same species. For a transplant to be successful, the tissue has to be similar. So if we're dealing with blood, that ABO system or other blood antigens like the Rh factor need to be compatible. That's much simpler than transplanting tissue or organs, because with tissue or organs, we're concerned with MHC antigens, and we know how many there are of them, thousands, and we want them to be, of course, as closely matched as possible from the donor to the recipient. So after a transplant surgery, a patient must be treated with immunosuppressive therapy, therefore suppressing their immune system. So the leading cause of death among transplant recipients is infections from bacteria and from viruses because of their suppressed immune system. But without it, they wouldn't be able to accept the organ, even under best case scenario matches. And you can see after 10 years, 50% of patients will reject their transplant. Immunodeficiency diseases are diseases that will compromise the immune system. One type, SCID, we can see it stands for Severe Combined Immunodeficiency Syndrome, is a genetic defect, and there will have a deficit of B and T cells, and of course those are extremely important in adaptive immunity to fight infections, so even a minor infection could be lethal, someone with this syndrome. AIDS, Acquired Immune Deficiency Syndrome, destroys our helper T cells. That depresses our adaptive immunity because HIV, the virus, attaches to CD4, which, remember, when those are activated, become helper T cells, enter the cells, use an enzyme that they have called reverse transcriptase to produce DNA from its viral RNA. So that DNA copy directs the host cell to make more viral RNA protein. So the HIV virus will multiply inside of our helper T cells and destroy it and go on to infect other helper T cells. It's transmitted through body fluids, especially blood, semen, vaginal secretions. Here are some common modes of transmission. Now, AIDS begins when the immune system collapses. So HIV is the virus, as it's suppressing the immune system, which can take years, but once the immune system collapses, that's when we term the disease AIDS. And now it's an opportunistic illness, meaning infections that a normal immune system can easily handle, not so much so when your immune system is suppressed. Autoimmune diseases occur when your immune system cannot distinguish self from non-self, which is a primary property of the immune system. So our immune system will produce autoantibodies, auto means self, that destroy our own body tissue. These are examples of autoimmune diseases where our immune system is attacking our own tissue. In rheumatoid arthritis, it destroys our joints, myasthenia gravis, nerve muscle connections. Multiple sclerosis destroys our myelin sheaths in our central nervous system. Graves' disease causes hyperthyroidism. Type 1 diabetes mellitus destroys our pancreas cells. Lupus, multiple organs, especially kidneys, heart, lungs. Glomerulonephritis, this will make more sense after we cover the urinary system, but damages the kidneys. So, of course, treatment would be to suppress the entire immune system so it doesn't attack your own cells. And here's some write-up on that. So a hypersensitivity is your immune system overreacting or responding to something that's actually harmless, but it's seeing it as a threat. Different types, distinguished by their time course or whether antibodies are involved or whether T cells are involved. Because antibodies cause immediate hypersensitivities, subacute. T cells will cause delayed hypersensitivity. So think of immediate hypersensitivity as just allergies. That's acute or type 1 hypersensitivity. So just seconds after being in contact with an allergen, you get the symptoms that you would associate with allergies. So an allergic response, there's our allergen, or the specific antigen that causes allergies, will eventually produce the plasma cells, which will release its antibodies. This happens to be IgE in an allergic reaction. The antibodies will attach to mast cells. Remember what mast cells produce, but they're starting to create their histamines, but they're contained in granules within the cell, and now they're sensitized. So if more of these allergens come in and combining with the IgE that it's attached to the mast cells from the sensitization stage, that triggers the release of histamines, and we know now what histamines do: cause the blood vessels to dilate, they become leaky, promotes edema, and that's swelling, large amounts of mucus, smooth muscles contract, right? All the symptoms that you would know of from allergies. And we're talking about local allergic reactions that involves the mast cells of the skin, respiratory, mucosa, gastrointestinal mucosa. If it's a systemic response, we call this anaphylactic shock, where bronchioles constrict, make that difficult to breathe. Vasodilation causes low blood volume. This is extremely serious. Epinephrine would be the treatment that needs to be injected in order to counteract the anaphylactic shock. Antibodies will also cause subacute hypersensitivities, but IgM and IgG versus IgE antibodies. Like a cytotoxic reaction, that would be the type 2. For example, a mismatched blood transfusion would cause this type of reaction. Type 3, immune complex hypersensitivity, where huge numbers of insoluble antigen-antibody complexes form. They can't be cleared from a particular area of the body. That causes intense inflammation, cell destruction, and lupus is an example of our type 2. Now, our delayed hypersensitivities are type 4. They're the only ones that don't involve antibodies but involve our cytotoxic T cells, which result in certain allergic conditions like dermatitis, chemicals that exist in some cosmetics, and interestingly, our tuberculosis skin test depends on this reaction as well.